Everybody to the Wellman's podcast, coming at you with Brian, myself, and Dr. Sunita. Today we're going to talk about, I have really mixed feelings about this episode, but today we're going to talk about circumcision. Anyway, just to introduce Dr. Sunita. Dr. Sunita is a friend and colleague of mine and my wife. We went to Bastyr University together. Dr. Sunita teaches at Bastyr University, or taught there since 2009, right? And now you're currently teaching at the University of Washington?
Mm-hmm. Yeah, I teach a tiny bit at Bastyr, but mostly at the U.
Okay.
Yeah.
And has an impressive background, I must say. Graduate of the University of Chicago, graduate of Bastyr University, has recently been elected as a co-president of the Midwives Association of Washington State, if I heard that correctly the other day. That's
congrats.
Yeah. Hey, thanks. I needed more things to do.
Exactly. Like running your practice, Eastside Natural Medicine, and teaching, which is fast becoming the most well-known practice, or at least feeder practice for Bastyr University, from what I understand. You're teaching a lot of students that come through that clinic, right?
Yeah. We created a residency program, and so now that's moving along. Yeah, it's cool to pay it forward, really.
Yes, and you're the one to do it. I mean, thanks for being a leader for naturopathic medicine and bringing us to the next level. So it's incredible what you're doing for us. Actually, all of Jillian's friends, all of you guys.
I know.
You, Jacqueline, all of you, Hillary, all of you guys are like bringing us to the next level. But anyway, so this topic is something that I've had numerous discussions with my parents about, yelling at them for why they circumcised me and cut me. So, of course, my parents just threw their hands up in the air and go, I don't know, Keone, leave me alone. I mean, this is what they did back then. So I don't know. I think they're still doing it. So I just want to know, where the hell did this come from that we're circumcising little boys, and what is the reasoning behind it? The only thing I can think of is there some like religious significance to it, which is even more disconcerting to me. But Sunita, if you can help quell my anxiety, because every little bit of length I can get, I would love, and I could, having my foreskin would give me a little bit of length. But anyway, go ahead. Tell me, tell me where this came from and why we do this.
Well, it's challenging to know because there's a lot of history blogs out there, which, people will bring those to my attention and say, hey, by the way, this is the significance, or hey, by the way, this is the significance. But it seems like the practice actually predated biblical times.
Oh.
But we don't necessarily know how far back, because then it wasn't recorded well enough, at least in written form, that we now use to say like, okay, this is when it started. But, we're talking about like 2,000 plus years is when it started. And it seems like it was related to decreasing sexual pleasure and having some element of limiting sexuality. That's one account.
Of course, other people, that's religion. Religion has this really weird relationship with sex, right?
Yeah. I mean, I would say a lot of cultures do, even if they don't specifically identify it as a religious prescription. It's really deeply embedded in a lot of cultures, even where people are cultural but not religious.
Okay.
Like I would say, for instance, like the way I was brought up, and we're talking about relative modern era, in the last 40, 50 years, that like I was not raised as part of an organized religion, but there were definitely a lot of cultural prescriptions that are deeply, where religion is deeply embedded in that, and vice versa. So sometimes it's hard to figure out what part's religion, what part's culture, and, who started what.
Yeah.
But what my whole thing is, so you said it predates biblical times. So when I say predates biblical times, we're talking about before the Common Era, after or before Christ, before the New Testament, which then brings me to the Torah, or what we know as the Old Testament, which it's definitely in there. in the Old Testament, from what I understand. So that could be thousands of years. So it seems like it's more of a Jewish type thing based on
I mean, I would say based on the stats, at least in the United States, I mean, the groups of people who tend to circumcise more regularly identify themselves as Jewish and also Muslim. So it's present in both religious practices. And definitely, I mean, I have it's interesting to see the differences from my perspective of having grown up on the East Coast, like in the New York area, around a lot of people who are of Christian faith, but identify mostly as Catholic, Protestant, and then being on the West Coast where people identify as Christian, but not necessarily one of those other things. And the identification with Christian out on the West Coast, they seem to have much more of an affiliation with the practice of circumcision. So,
on the West Coast.
Wow.
Yeah, interestingly. But with the brand of Christianity that I have observed out here that is different than what I grew up with on the East Coast. Like, it's just interesting. So that kind of is like, it's the religion, but also the cultural piece that gets tied together there. But I mean, in the end, it does seem like it's related to our history with culture and religion. It seems like it stemmed from kind of pre-Christian time, so definitely Old Testament. And there is that piece that it is partly like a sacrament. It is really just, it's part of being in relationship with God. And ultimately that sacrifice is partly how to create that relationship with God.
Okay.
What a sacrifice. Make that
Yeah, wonderful sacrifice. Well, at least it wasn't a prescription of like plucking your eyeball out. I mean, I guess because if that was in there, I'm sure we'd all be doing that too. Anyway, so tell me this: if with this practice, which they did, it seems to be like having some type of identifying you're having some type of relationship with God, right? That's where we think it stems from.
Yeah.
Okay. And then from that, it became cultural, right? Is that what you're saying?
Yeah.
Okay.
Yeah. Then I think it, from being some kind of religious practice became more of just a cultural practice. And now, like, as your parents said, like, it's just what we do.
Yeah. It's just what we do without questioning it. Right. So, but all right. So if it began as a religious thing, was there anything about it that, besides being a religious thing, that is good about it? Like, was there any, did it?
I've heard just that they've done it for like cleanliness and
like what
and things like that. But
yeah. Well, no, that's a number of people have asked me that question too. Is it possible that it's possible to keep it cleaner? Well, yeah, I mean, I'll say, like, just logistically, period. It makes sense that the less folds and hidden places you have, the more likely, the easier it is to keep clean. There's a couple different ways to look at that. I mean, so again, kind of thinking about history, it's interesting that in certain parts of the world at the time that the practice became more widespread, cleanliness is one of the things that's cited. Well, it made sense because, maybe bathing wasn't a frequent practice. I don't know, whatever, something like that. But then you see that, like, Hindus and Buddhists don't necessarily have this practice as part of their culture. And they're from parts of the world that were also hot and, tropical, and it didn't seem to be necessary in those particular areas. Maybe water was more plentiful. I don't know. This is all conjecture, right? But it's just sort of that's one thing that kind of was like, maybe it's not really about cleanliness. There was a paper that came out, I want to say it was like around 2012, where the author correlated being not circumcised with higher incidence of urinary tract infections, higher transmission of HPV, and higher transmission of HIV in later on in life in those boys, but then also adult males eventually when they became sexually active. Which again kind of makes sense that if you have more hidden places, there are things. There's always the possibility that more things can get trapped there. I think in his study, he also talked about, I think he said as high as 50% of people who are non-circumcised will have an infection or condition related to the fact that they're specifically non-circumcised, which I thought was interesting. That's a lot. And that makes people feel afraid, right? An infection or a condition with my non-circumcised penis? Of course, cut that thing off. It's like, okay, but there's still 50% of people who don't have a condition or an infection. That was one thing.
Right.
And that a lot of those things are preventable, like urinary tract infections. Yeah, there's lots of other things you can do for urinary tract infections. There's this cool thing like science and medicine, and a lot of natural therapies that we can use to manage urinary tract infections. That doesn't necessarily involve removing a portion of an infant child's penis, you know?
Right.
There are other ways to do that. Like you can prevent HIV and HPV transmission with condoms. There's lots of other things that we can do about that.
And you can just keep the area clean and teach your child how to keep it clean and all that.
Yep.
Yes.
Absolutely.
Yeah, it's not like they're cutting off like gluteal folds and you have the same
right, exactly.
Mm-hmm.
That's a great point. Like, you know, there's still dark, damp areas on your body.
Right. But that's interesting to me. So there has been research done that points towards the reason as to why we do this, or not so much?
Yeah.
Okay.
Well, or why it might still be relevant in the modern era. You know, it's sort of
Okay.
taking out of the context of history, like why we might still want to consider that. You know, and the author in that paper went so far as to say, I think just like in a different commentary, I don't know if he said that in the results, he was saying that, you know, to not offer circumcision to families who've given birth to an infant male is akin to not offering them immunizations or other medical treatments.
Oh, come on. That's ridiculous.
Yeah, I mean, but he's thinking like cost burden, right, of infections and things. But, you know, I also think that there are other pieces of education we can offer those families.
Yeah, I agree.
In addition to that.
Right. Well, you said something interesting at the beginning. So is there research that it actually decreases sensation or sexual pleasure or anything like that?
There isn't. There are a number of people who are
here. Okay.
Yeah.
Well, how would you know too? That seems difficult.
Yeah.
Right. I mean, you don't necessarily get to have a lot to compare it to. I know a couple of adult males actually who were circumcised older, but meaning like 6 or 7, not at infancy. Ironically enough, it happened when they were having their hernia surgeries at 6 or 7 years old. And then at that point, you know, they were like, yeah, just throw on the circumcision. We never did it at that point. Might as well. So they remember actually waking up and being like, what happened to my penis? It is swollen and painful and scabby. Yeah.
Right.
And not really knowing what happened. So, you know, there's lots of other issues there, like consent and, you know, all that. But
yeah, I would imagine that image would stay with you.
Yeah. Yeah. So those, you know, I've talked to a few of those people, a few of the dads in my practice who were, you know, then definitely vehemently against circumcising their own sons because they remember what it was like to wake up, but they didn't necessarily have a lot of experience in terms of their sexual history at that age. So they couldn't really say a lot about like what it felt like sensation wise before and after, other than that immediate sensation of waking up post-surgery.
Right. Now, do you see a difference in how male, like the father and the mother kind of attack this issue?
Definitely. This is one of my very favorite stories ever, but a lot of what happens when parents come and talk about it is, you know, a lot of the moms will stereotypically say, you know, that's your department. I'm not going to make that decision. And they leave it to the dad to make the decision about the child's penis, which I think is just a very interesting compartmentalization.
Right.
On one level, it seems totally logical. You have one of those. I don't. You should decide what happens to that. And at the same time, you know, I'm thinking, well, if she was pregnant and birthed the baby, it's like you also made that penis. So I kind of feel like you have a say in how that happens, but you know, yeah. But I also, there's a lot of interesting dynamics postpartum in terms of how parents hand off decision-making to empower or disempower each other. Yeah. So that's one piece of it. And then dads will often come at it from the perspective of like, well, I am, and I'm fine. So, you know, my boy should look like me. So the whole look like me thing is probably the most often cited argument by my male parents hands down, you know, in like thousands and thousands of families, it is absolutely the most common argument. And I think it's funny, this one story in particular, I'll try to make it short. There was this family that we took care of. They decided not to circumcise, and they figured at some point they would have a conversation about that, but weren't quite sure. And the dad was a little uneasy with it, but mom was like, no, we are not doing this thing. So he was like, okay, cool. I can go along with that because I don't have a good reason to do it, or strong reason. One day they're standing in the shower. The kiddo is probably only like 3 or 4 years old. And at some point in the shower, he looks up, he's like, Dad, when is my penis going to look like yours? And the dad's like, for real? We're having a conversation here right now in the shower. I'm not even prepared. This is ridiculous. And then to his credit, he stops and he asks, what do you mean? And he's like, well, when's mine going to get a mustache? He wasn't even looking at the foreskin, right? Like, I mean, he's a kid.
Yeah.
He's like looking at the very obvious thing. And I think that's also a good point, you know, and I share that story all the time with parents and they think that's funny. But also, like, it doesn't look like yours. Like, that's the reality, is like, they're an infant, you're an adult. At the point that he's going to look like you, he's going to be like 15, something like that, a little older.
Right.
You can have a conversation with a 15-year-old about why you decided not to do that to their body.
Right.
Yeah.
And I think that they'll probably respect your decision.
I think you're exactly
unless
right.
it's Keone.
Yeah. Well, here's the thing. Yeah. So I think let them make the decision. And what person, what male at, you know, or anybody is going to say, oh yeah, sure. Just, you know,
just trim this.
Just trim this
Right.
off. Take the tip of my penis off. That's great. You know?
No.
Yeah. Nobody's going to say that, but,
No.
you know, so it's kind of, it's just kind of crazy to me that this thing stemmed out of a religious thing and then became a more of a cultural thing. And then I go to the place, well, all right, so maybe there's some sanitary aspect to it, but what about all the potential complications you may be introducing by actually doing a surgical procedure like that?
Yeah.
Right? Aren't there some issues with that in itself?
Oh yeah, absolutely. You know, one of the old stats, and this is old, like, you know, in science, old, like 10 years ago, where they used to say that there was a certain percentage of people who would need a circumcision if they didn't circumcise because of various complications, like maybe the opening, like the urethra, wasn't centered, and, you know, and then in order to actually have it like pee get out, they had to circumcise. Like, there's some like unusual medical concerns. But that there was a certain percentage that would need to have it revised, you know, or have it done again, or have complications from the procedure, and that those stats were kind of equivalent, that you would possibly need to have it redone or possibly need to have it, you know, whichever way you decided. But what actually looks more true is that there's more consequences from the procedure than there are actual conditions that require circumcision.
Wow.
So, I mean, just in my practice alone, this is just my stats. So we have about like 7,000 patients or so. We have, you know, maybe about 4,000 are like pediatric people. And roughly half, like, it's kind of interesting how it plays out 50-50, you know, are male pediatric people. Out of the babies who've been circumcised that we have noticed, and we've been sort of kind of unofficially keeping track, we've had many more kids actually have to go in and have revisions of their circumcision, or we have to use some kind of topical steroid to decrease the adhesions or scar tissue that forms, or have complications from the numbing medication, like the lidocaine that they use topically, or from other anesthesia, than kids who've actually needed to have a circumcision. I've literally had one kid in over a decade, one baby, who's actually needed like a medical circumcision. And I've probably had at this point close to 100 kiddos who've actually had to go have either another procedure, which then they do under anesthesia, like full anesthesia, general, where they, you know, essentially put the little mask on and have them sleep at a year old to correct the thing that didn't happen correctly at the beginning. And there's a lot of reasons for that. Like, you know, you don't know how you're going to heal. You don't know if you're a scar tissue maker, you know, or like what kind, like whether you heal well or not until you have a thing that happens. And you're like, oh, I'm the person who makes really thick adhered scar tissue. And that's how you find out. It's, so that's one of the reasons that happens. Or it's actually the skill of the practitioner. There are a lot of people who don't do it as often anymore because there are fewer and fewer people doing it each year.
Yeah.
And their skills are different. And then I have seen that play out hands down in the skill level of the provider and the number of kiddos who've actually had to have it redone. So it's interesting to think about. And I mean, and I enter that into the informed choice conversation, you know, just know that if you're going to have it done with a provider who does this all the time.
Right.
And who's really, really skilled, but also know that there's complications. You know, yes, it's a fairly straightforward procedure, but there are things that can absolutely happen as a result. Like anytime you enter anesthesia and cutting into a situation, you are always introducing the possibility of bleeding, infection, reactions, and, you know, the whole gamut. Anytime you're doing anything like that.
Right.
You know, same as like with ear piercing, you know. Oops,
Mm-hmm.
that.
Now, when does the procedure typically take place? I'm completely uneducated on when someone would make this choice.
Usually within days of the birth.
Okay.
What was typically done in a lot of areas, and I'll say like in our little Pacific Northwest bubble, I feel like things change a little bit more rapidly, for better, for worse, than often will happen in other parts of the country. But it used to be that before discharge. So if people stay in the hospital for 24 hours after the birth, the baby's usually getting circumcised within the first 24 hours of life.
Okay. And at that point, they're using a numbing agent, and what's kind of the procedure like? There
are a couple different procedures, but the idea is, I mean, think of it as like they put almost like a little bell. If you've ever seen like a dog with the big like
the cone
around its neck, the cone of shame, you know, it's a little bit like that, or a band, and they're kind of almost just using that as like a tracing, you know, marker, and they kind of go around that and just literally remove the foreskin right off the top.
Okay.
So, you know, procedure-wise, it's pretty straightforward. But, you know, you're talking about a very, very, very small penis. I mean,
yeah.
So your margin of error is just very small. That's all. You know, it's not that people are being rough or,
right,
you know, mishandling the situation, but like literally you're talking about, I mean, half of a millimeter of space. So.
Sunita, what is the purpose of the foreskin? What does it do? Is it just there? Do we just, I mean, what do we think it does? It gives us more sexual pleasure, but doesn't it protect the head of the penis to some extent?
Yeah. I mean, that's the interesting thing about it is that when people think about, well, what is it there for? You know, just like, I mean, female genitalia has lots of folds and covers and things like that. Like they're also protective, right?
Right.
So there definitely is, at least in people who are still intact, it seems like there's higher amounts of nerve endings there. So it's definitely like sensation, and specifically related to sexual pleasures, like it's considered an erogenous zone as well. Mm-hmm. So there's the possibility that argument of decreasing sexual pleasure is true from the past. But also that it probably serves as a little bit of a protective agent.
Yeah.
It can also be a catchment for infection, but there's also the possibility that it was a protective agent.
Yeah, I think so. I've had patients, including myself, on certain days where the head of the penis is going to rub, rub against the, underwear or pants or whatever, and get irritated that way. And that force there could help prevent that from happening. Yeah,
I mean, I don't think that, depending on how you think we evolved or were created, I don't think that people were thinking about like microfibers and clothing. We weren't wearing clothing at that time, so people weren't thinking about seams and stuff like that. But just literally that, for men, like their genitalia were literally just hanging outside their body.
Right.
It makes sense that you'd want something to cover the end of that.
Right.
So, if you think about how we or where we might have come from.
So yeah, the whole procedure is just, I don't know, when you really think about it, at least for me, it's crazy. I mean, it's just, it's like one of those insane things where I'm just like, why the heck do we do that? But,
Well, I'm getting the impression that the research is kind of split as far as
it is.
It's 50-50 as whether or not you should do this. Is that a correct assumption?
Yeah, I mean, so that paper that was published in 2012, it definitely had some really compelling findings. I mean, there are correlations, not causations.
Right.
So, I mean, I feel like that always keeps coming up of, there are other ways for those things to not happen, like urinary tract infections or sexually transmitted infections.
Right.
Like we do have other skill sets in those areas. But also when people looked a little further at his paper, there were some issues with the methods and the data collection and all of that too. So there's definitely some, like to go into the research aspect of it, there are some issues with how all of that was created. So it depends on who you talk to and whether or not you find that evidence compelling or not, or truly split. The American Academy of Pediatrics and ACOG, the College of Obstetricians and Gynecologists, both still their policy statements are that the benefits do not outweigh the risks. And it is ultimately elective cosmetic surgery.
That the child has no say in.
Ultimately elective.
That the child has no say in and really can't consent to it. It seems like
it's the opposite of an elective. It seems like a core.
Right.
It's like a core class.
Actually, that's a very good point, right? I mean, because who is electing it, right? It's not we wouldn't really elect plastic surgery or some reorganization of baby's appearance unless it truly affected function. In any other situation. Like, I mean, if you're talking about cleft lip, cleft palate, where plastic surgery is a major portion of that surgery, that affects feeding. I mean, babies can't actually receive food and create suction, with their palate or the roof of their mouth if it's not remedied. So it's not just for physical appearance, it's actually for function. So it's one of those things that's very interesting. Would you get your baby a boob job? I mean, so she looked like mommy. I mean, it's it's interesting to me to dig into the reasonings and for people to kind of dissect it for themselves, like how much they've taken in from that. The conversation I always think is interesting too is ear piercing, because this comes a lot with female babies, and there are a lot of cultures that pierce babies' ears right after they're born. I mean, I know I had this conversation with Jean Paul where I was like, if we have a little girl, I'm going to tell you, like, I'm going to want to pierce her ears. I was like, we don't have to do it. And I was like, but there's going to be a compulsion in me that wants to pierce her ears. Mine have been infected 17 times over, but and I keep getting re-pierced, I don't know, whatever. I was like, but there's that thing. It's a cultural thing. It's so ingrained, and but it looks so cute, she'll look like me.
Right.
And he's like, we are not doing that. Why would I pierce my baby's ears? And I was like, I know. And ear piercing is a major bone of contention in families. They're like, no, they can't get their ears pierced until they're 6 or 7 or middle school, or it's something they have to earn. It's a right. It's ear piercing.
Right.
And we have a lot of cultural baggage around that in this country, not in other not in other cultures where it's of course you pierce their ears, that's just what you do. But here people are they withhold it, that's something that is for bigger girls or teenagers, but not for little babies. But we're totally fine with cutting a skin off their penis. But ear piercing, nah, that's too much. That's taking it too far. It's just
it makes no sense. Jeez.
No, it doesn't when you kind of look at it like that. And, of course, I don't mean, when I talk to parents, I also want to be really respectful of their belief systems. They're not mine.
Yeah.
And I have been to a bris, actually I've been to 2, which is, simultaneously a naming ceremony and where they do the circumcision. And a mohel performs the circumcision, and the whole community is there and receives the baby, and the baby is, kind of invited into the community, but also, invited to the community of God. And so there's definitely something that is not part of my history and my story, but I can see that as part of other people's. And so that ritual that accompanies it is really impactful.
Yeah.
And the circumcision is almost kind of like ear piercing. It's just sort of that's just what we do,
Yeah, Yeah, it's got that ceremonial aspect to it for sure.
Yeah.
Yeah.
But it's interesting, like the hospital or like going back 2 weeks after a baby's born to then have it done like in a clinic, that becomes a highly medicalized procedure. And that's kind of where I feel maybe is more my purview to weigh in possibly a little more heavily. You know, again, my job is informed choice and shared decision making. But if it doesn't have a really strong religious significance, then it's really important for us to figure out what are the medical elements of this, and is it medically necessary?
Yeah, but I would also add, and again, I know my bias comes through on a lot of these podcasts, but I'd also add that many religious people don't even know why it's going on. They don't know the reasoning, the ultimate reason why it's happening. So I think a lot of people need to be told that. Maybe they are, but you know, what's the reason for it? Well, it's a covenant with God. If you're Jewish or of Muslim faith, I think that's what it comes down to. But then when you really start thinking about this, is a whole nother discussion. I don't want to get into this because I certainly don't want to offend any of our viewers. But then there's a whole nother discussion on top of that. Well, why do you need to do that to be faithful? You know, like it's like what's the reasoning for that? And then for me, it comes back to this whole place. Well, gosh, what is the weird significance with sex and genitalia with certain, you know, religions? Like to me, of somebody who is a non-believer, it's a bizarre thing. And then you go to places now. Let's talk about you know, female circumcision. You know, it's kind of the same thing, right? Or well, actually, I think it's worse, right? Because what's going on with that? With female circumcision, is it just, are they just taking skin? Are they taking the clitoris off? What are they doing with that?
Depends. There's various levels. Sometimes it's removing the labia, so the ones like kind of on the outside that people can see, the labia majora. Sometimes they also remove the labia minora, kind of the ones inside that, and also the clitoris. So there's sort of varying degrees.
Wow.
Yeah.
Yeah, and I'm even showing my bias there because my reaction to all that is like, oh my God. But meanwhile, mine is like, okay, I guess they decided.
Right. Right. What? So tell me, with female circumcision, what is that also a religious thing too? Is that where that's coming from?
Generally, yeah. You'll see that more.
We don't do that in the U.S., do we? Or do some?
There are communities, but communities that have mostly immigrated from other parts of the world.
But it would never be would it be a medical procedure? Like, could you go?
No.
Oh, okay.
Yeah. Is there never a situation where there's that medical need, kind of like that one instance you mentioned for the boy?
I mean, cancer.
Okay.
You know, I mean, I can think of like if someone had vulvar cancer, then actually having your labia removed would make sense, if that's the part where the cancer started. But yeah, that's a really great question, right? To think about. Well, but we don't medicalize female circumcision. We only medicalize male circumcision. And I think a lot of people have a similar reaction. Well, how do you feel about female circumcision? And a lot of families are like, oh God, no, you know, that's barbaric.
Right.
Like, okay, you know, just gonna let that one sit. But it's really interesting to like be shown our own, I don't want to say hypocrisy because that's a loaded term, like dissonance, you know?
Yeah, absolutely.
Insurance plays a big role in it too, about whether or not people care enough because Medicaid stopped covering it. Probably about 2012, somewhere in that ballpark. Right around the time actually that the American Academy of Pediatrics and College of Obstetricians and Gynecologists put out that joint policy guideline about how it's not medically necessary. Medicaid and a lot of private insurers stopped covering the procedure.
Yeah.
So when families had to consider paying out of pocket for it, it was not as important.
Wow. I'm joining Keone on the bench down there, getting angry at my mom. That's interesting.
You know what's so funny about this conversation? You guys have always heard, like, you know, you talk about something, you talk about buying a product, and then all of a sudden it pops up on the internet. Well, obviously the internet gods have heard me because I'm talking about my penis all the time and how I'm pissed off that, you know, I'm missing the force. But anyway, I'm getting all these pop-up ads for like ways to lengthen your foreskin. I mean, it's like ridiculous.
Yep.
I'm not getting those, Keone.
Well, you probably start now that we did this podcast.
Yep.
But anyway, so I guess that's my question to you. Like, there's this really weird contraption where you can put a weight on the end of your foreskin, like stretch it. To, I don't know. I don't know if I want to walk around with a dumbbell hanging off the tip of my penis to stretch it, but that's obviously that can work. Is there a cosmetic way to get your foreskin back? I'm waiting for the days of the using stem cells or something.
Possibly. Some people are doing the stretching. I have heard reports of the grafts where people are actually having tissue removed from other parts, but then it's cosmetic because you don't necessarily have the same amount of nerve endings. Like, I mean, if you graft from, say, your gluteal fold or something like that, it's like you're not really getting a super highly innervated area. So it'll physically be there, but you won't necessarily get the use out of it.
Okay. No, in the same vein, Keone was joking earlier about losing some length due to getting your foreskin cut off. Is that factual? Did my mom make the choice to give me a smaller penis?
Yes.
I mean, if you think about the fact that like when the foreskin's intact, it can kind of hang over the end of the head of the penis, like a good extra centimeter. Yeah, but it definitely looks different. I mean, it definitely looks like extra skin on the other side.
I'm getting mad.
I'm
getting mad, Keone.
And it'd be much easier to stretch an intact foreskin than one that's not there. So.
Oh yeah. I think about the stretching practice. I'll admit there's not a lot of evidence out there. I think it's mostly just reports. Like, when people have brought up some of those blogs and things, I'll read them. It looks and sounds quite painful.
Yeah.
And I wouldn't recommend that practice, but
Teach their own, right?
To each their own.
Yeah, the whole, it's just, I gotta, Brian, I'm telling you, we have to write a book with all this stuff that we just think, the outrageous stuff that we do culturally and in society. That when you really think about it, you're like, why?
Yeah.
Why would you do that? So anyway.
I love talking about that stuff. One of the classes I teach is lifespan development. So, you talk about like, from embryonic times all the way through death, and that's kind of the course. And then all the way through it, we're constantly talking about like culture and how are the things that we think are normal development, actual normal physiologic human development, or are they is the normalcy crafted by culture? Yeah. And that is, so we talk about circumcision at that point. And a lot of things that we do with babies in particular are highly ritualized. There's so many things that we do around infant care that are highly ritualized. And are those things necessary, and where did they come from? And so then I'll usually have people go and kind of dig into their own personal stories and their history and go ask their parents, why did you do this thing? Whether it's circumcision or a naming ceremony or, whatever it is, or keep me in the house for 3 months, and never let anyone hold me or something like that. Right.
And it really is up to the parents, right? I mean, it's not like when the baby's born, the doctors aren't going to take it and like circumcise.
No. To the parents. They did. I mean, obviously in those those 2 adult cases that I know well, there was no consent even from the other parent, or the child.
Wow.
So like in both situations, the dad was like, yeah, go ahead, do that thing too. And the docs were like, okay. So, I mean, you can definitely see how strong the patriarchy was in those situations. And those were those were major urban areas. Like it wasn't necessarily like oh, that's the guy that I play on the softball team with or something like that.
Right.
Yeah. So it's interesting how all that decision making happens, but the parents have to agree. They have to sign a consent form. They definitely hear all the risks and benefits of the procedure. So when it actually happens in a medical setting, I would say maybe even slightly different than a more religious setting. They, as part of the consent process, they are talked to about the anesthesia and the possibility of reaction or death from anesthesia. And the possibility of scarring and adhesions and the rate of recurrence and having a repeat surgery, and then how that would have to happen. So they do get to hear some of that stuff. I've had a few parents decide not to go through with it after having that initial consultation.
Do you actually do this procedure, Sunita? I mean, if somebody asks.
No. And, I thought about actually shadowing one of the docs in my community who does a lot of them.
Yeah.
I work with a lot of his families because there's an injection that babies have to get after they're born called vitamin K. And it's something that helps their blood clot. And so there are families in the community that decline this injection after the birth because they equate it with immunizations. It's not, or just don't want their babies to have the injection.
Okay.
But they want their babies to be circumcised. And then, so he and I have gotten into a lot of conversations about that because he thinks it's very interesting that people won't do the vitamin K injection, but then want to have their baby circumcised.
I think that's like really kind of a disconnect there also.
Yeah, it's sort of interesting. So then we've talked about whether we would do this procedure with babies who have not received vitamin K, because in the traditional Hebrew, or the Hebrew tradition, they actually will do day 8 when the baby's making what we think are sufficient levels of vitamin K. So, but this guy definitely he has he's worked at a hospital for a long time, is also a moil, he's a very well-rounded practice. So I thought about, chatting with him and maybe trying to shadow him and learn just to be able to offer that thing, that service to my patients if they felt really strongly that they wanted to work with a provider that they knew and trusted. But the reality was I kind of, I came up on my own bias. Yeah. I felt like I couldn't do it because I couldn't be as well-rounded as he is. I think, he sort of has that religious grounding that, so he feels like he's able to serve from that perspective as well as from just a skilled medical perspective. That I was like, I would acquire the skills potentially, but I would not necessarily acquire the philosophical context. Right. So that's a very long answer to say no, but there's a good person in my community that I refer to all the time if people decide after they've learned and done the research that this is the thing that they want to do.
But what you're also saying is if you're going to have your child or infant get this procedure, they need to also have the vitamin K shot, right?
Yeah. And that was an interesting thing that came up for me a lot with midwifery practice. As you see a number of people who are, I won't say wanting to decline all things, but just are more likely to decline procedures, period, than say in comparison to people who birth in the hospital. So I had a lot of clients who were declining vitamin K and, but then still wanting to be circumcised, having their baby circumcised, which was an interesting, I don't want to say argument, but sometimes heated discussions that I would end up in with some of my families. One actually I remember very poignantly was at a home birth. And it was after the baby was born. And so I'm talking, the baby was born a little bit earlier than we got to have this conversation in prenatal care. So I said, we didn't get to talk about vitamin K. And unfortunately now we have to talk about it here at the birth, so let's have a discussion about what it is and what it does. And the father was really adamant that the kiddo would not get a vitamin K shot. We're not putting anything or in his body that, his body is, as he said it, intact and pure, made by God. So we're not putting anything in or on his body. But yet, to alter that.
We'll take it off.
Yes. And I said, but correct me if I'm wrong, you guys are planning to circumcise, right? And he said, yes. And he said, well, then unfortunately, you will not be able to find a provider in our community who will do this without vitamin K. I said, vitamin K helps babies blood clot. And if we're going to do something involving cutting and creating blood flow, and possibly the excess of bleeding, you're going to want to have that protection on board. And he was pretty angry with me. I mean, it's like I'm sitting on the floor in their house, in their bedroom, and he's yelling at me about how I'm forcing him to take, enforcing his baby to undergo medical procedures. And I'm like, huh, wow. I'm like, I literally just sat there like, I am so confused right now.
Right.
I don't really know what to say about this at all. I was like, I am not going to inject your baby with anything until you tell me it's okay to do it.
Right.
He said, but you're also not going to find someone who will help you with circumcision. So you'll have to revisit this discussion, if not today, at some point.
But they don't have to get it right away, right? The circumcision can come 10 days, a couple weeks later. It's that, and
apparently years.
They be out of
right.
Yeah, that's when it should.
Yeah, I mean that's the realities. Babies or people could be circumcised anytime, right? So, the other doc that's in the community who does it, and I think is really skilled. I mean, one of the things he likes to do is he likes to wait until babies are a couple weeks old. Just get breastfeeding established. If people are planning to breastfeed, just get feeding established. Make sure babies are gaining weight, they're thriving, and then he's working with a healthy, strong, thriving baby, as opposed to doing it right after the birth. And the right after the birth thing wasn't because that's the best time to do it. If anything, they're really, really swollen right after they're born everywhere. Their face, their ears, their penis, everything is swollen after being, squeezed through the small tunnel,
right.
Or pulled up through, a small incision in the abdomen. So it makes sense to do it a little bit later, wait till swelling is down, and then you're sort of more accurately seeing, everything really, the very, very small millimeters of space that you're working in. But then you're also you're bettering your chances of not creating complications related to a baby who is possibly not thriving, or, just having other, you don't even know at 24 hours. But the idea of 24 hours is it's point of service, right? You're there, rather than having you schedule another visit to go somewhere else in 2 weeks. Why don't we just do it while you're here? There was really no other reason for that.
Right.
Part of that's also insurance coverage, because if you have it done while you're in the hospital, then you get the doc and the facility fee covered right there because you're already there. You don't have to get readmitted.
Now, what is the post-surgical care like? Because as a physical therapist, when someone has surgery, you kind of want to go in there and help mobilize the tissue that just was healed, and so you don't have those adhesions build up like you mentioned.
Yeah.
But I could imagine you wouldn't want to be mobilizing a baby's penis. So what is the post-surgical care like?
I think that's the part that a lot of parents are not super well prepared for. Maybe they hear it, but don't actually have a great sense of what the visual's like. So to paint the picture, a baby's penis is super red and swollen. It looks purple, and sometimes almost like very dark purple. So a lot of parents feel really concerned when they see that. They're like, that looks wrong.
Right.
But it's swollen and bruised, but in a very, very small amount of space.
Right.
We have a lot of families in our community that decide to do different diapering things like cloth or whatever. So we usually tell them just stick to disposable so that so you're changing them much more frequently. And you're not having things sticking to the incision site. So a lot of it is keeping it clean, dry, like you would any wound. And also they'll use Neosporin or some kind of something that has the consistency of Vaseline, also to keep it coated so it doesn't stick as much. And it can take days to up to 2 weeks to heal. The first 3 to 5 days are definitely the much more intense in terms of the healing for the baby and the care for the parents. We usually recommend that they're just doing diaper changes very, very frequently, kind of almost every hour. So they're not sitting in any amount of urine or feces that could possibly cause infection. So
talk about infection. Chop off the head of the penis or the
foreskin.
Sit in urine. That's a good idea.
Yeah, and that's the hard part, right? When you have babies who are literally, they're keeping their infectious agents right on their skin with the wound right there. So it definitely makes care a little bit more complicated than parents often think about. And that the procedure itself can take, the whole thing with anesthesia and checkup and the procedure is 30 minutes, but you're talking about days to a good week to week and a half of very regular around the clock aftercare too.
Yeah.
Sunita, tell me, so if after the baby heals and all that and they're fine, there's really no other, and there's no issue with the procedure, pretty much from that point on, everything's good to go, right? except for the mental, emotional trauma that somebody like me may have, or, you know, want the extra length like Brian may want.
Excuse me.
But there's really, and then rubbing on pants or whatever, right? There's no, okay. But what, on the other hand, so let's say you're not circumcised and you don't clean it properly, or you don't, there's some hygiene that has to be taught, right, to the parent and the child, right, about it. Like, you don't not circumcise it, but there's a discussion about cleanliness with it, how to pull back the foreskin and how to clean. Okay.
Absolutely. And I think that's the part that also makes a lot of families uncomfortable, because when they haven't had that context before, like, for instance, the dad circumcised and mom has never seen uncircumcised penises, she's kind of like, oh, what do we do with this thing?
Right.
It's not as complicated as people make it out to be, but, you know, I mean, there is some amount of retraction, but not a lot, because you don't want to over retract and cause scarring and adhesion that way. It's pretty hard to do. I mean, unless you're being really rough, it's actually pretty hard to just like forcibly retract a baby's penis.
Right.
But that definitely instills a lot of fear in people. And there's a lot of information going on about how you should never retract. It's like, well, okay, you're not talking about retracting all the way, you know, like, I don't know, a third of the way down. You're talking about literally just making sure you can visualize the top of the penis so that you can make sure there isn't like any cheesy stuff in there.
But if you don't retract, can it adhere to the head
potentially?
Of the, cause more problems. So you have to retract to clean it.
I mean, and the thing is, they'll all find it and do it on their own.
But you don't want to depend on that, though, right? You don't want to depend on that also.
No. But that's part of the conversation with parents, and part of the conversation with kids as they get older is like, you also have to clean in there, just like you have to clean in between your butt cheeks, and you have to use your toothbrush all the way in the back of your mouth. Like, these are just things that we teach people how to do, how to care for their body. Like, there are places where things get stuck, and you have to get in there too when you clean. You know, you have to wash behind your ears. And I think it's not part, again, coming back to the culture thing, it's just not part of our culture of caretaking for infants.
It's also a little bit bizarre, right? Like, okay, so as a parent, I have to kind of like, you know, mess with my child's penis. You know, people have issues with stuff like that.
Yes, absolutely. And I think that comes back a lot. Is that feels uncomfortable to me, like manipulating my child's penis. It feels like I'm doing harm. I've had this happen on the other hand, you know, from parents saying the same thing about cleaning their female child's genitalia, like getting in there, like it's the same thing. Like, you got to get in there with the wipes or the water and like clear out the folds. Like, babies are chubby and they have folds, and it's just thigh rolls, labial folds, you know, uncircumcised penises. Like, there are places you have to get in there and clean. Getting them in water is a great way to do that, because water will get in everywhere. You don't have to like get a washcloth and scrub and pull and so, yeah, I mean, people feel uncomfortable on both sides of manipulating their kids' genitalia. It definitely it triggers a lot of things for a lot of people based on their own story, but also just being really careful about not traumatizing their own children. Right. And creating a story that isn't true.
Exactly. Yeah. Wow. Fascinating stuff. I guess now, I just need to find something to like quell my anger. I'm going to get on the phone with my mother and father and yell at them in just a minute. Get off this.
We'll just put you on speakerphone and walk away. Just yelling at us again.
I know, my father's like, Keone's on the phone yelling at us about his penis. Yeah. Anyway, well, thank you so much. That was really informative, and I really appreciate what you do. I mean, thanks for educating us about that.
Yeah, my pleasure.
Yeah.
I mean, you know, at least in terms of hoping to squash some of the controversy, but you know.
Yeah, no, it's great. And then, by the way, Sunita, if you hear about any like penis lengthening things or foreskin lengthening things,
we want you back on the show.
Please get back on the show.
For the Will Man's podcast, be like, so we talked about what happened to you. Now let's talk about what you can do about it.
Absolutely. That podcast on that. Anyway, thanks again. We'll see you in a couple weeks.